What's up, everyone? Dr. Jackson here. Hope you're all doing well. I wanted to jump on and talk a little bit about masks and smiling. And I guess we're going to talk about communication too, one of my favorite topics. So let's roll that intro and get into it. Well, we in dentistry are very used to wearing masks, obviously. We wear them all the time during procedures. But what I found different when I got back to the office after coronavirus shutdown is that it's much more difficult to communicate with people without ever taking the mask off at all. Now, normally, especially when you have a patient sit down, maybe it's a new patient or you're doing some treatment planning, we'll do all the exams and whatnot. And then I have a tendency to go to our large TV in the operatories, point out some things, but I'm not wearing a mask at that time. We're not creating aerosols, we're just simply talking to people. Nowadays, however, with social distancing and the mask mandatory here in Illinois and whatnot, I'm wearing the mask. And it's hard because ultimately, people, for a lot of reasons, people can't really make out your facial expressions as easily. So I'm here to talk to you a little bit about smiling, communicating with your eyes, all that kind of stuff. So let's talk a little bit first, like I said, about smiling. I have gone through, the first day back, you're kind of hot and whatnot, and the PPE is cumbersome and it's new, and you don't really feel like smiling a lot. But I'm going to encourage you, the first tip I have for you is to keep smiling, right? It's the same old principle. This is not a new principle. It's the same old principle that we've always told administrative front desk people who answer the phones in the office. Please smile while you're talking to the patients because you can hear that in their voice. Just like they can hear that over the phone, patients can see that and hear that through the mask. So when you're actually speaking to a patient, smile when you want to smile. Don't feel that you don't need to. Don't feel like you can get away with it because your vocal intonation, your inflection will suffer from it. In addition, smiling changes your eyes. Your eyes are really, truly a dead giveaway. Ask any poker player about how much your eyes will tell. When you smile, you'll get little creases. When you're excited or when you're listening attentively, you'll see more whites to the eyes or less whites to the eyes. All sorts of great information can be gleaned from watching the eyes, the musculature around the eyes, the eyebrows. I didn't even touch on that, but the eyebrows as well, the eye area, we'll say. So make sure you exaggerate when necessary your inflection in your smile, in your voice. Be careful also, much like with texting, be careful with sarcasm because ultimately it's much harder to read people now. So if you're going to use sarcasm in your just banter with your patients, be careful because ultimately you want to make sure that they know you're being sarcastic. So maybe an extra exaggerated eyebrows up and big eyes. Give some hand gestures. Don't let them know that you're joking and ribbing them a little bit. Whatever you need to do, because ultimately by just sitting there straight and making some jokes, it may or may not be readily apparent that you're joking around or you're being sarcastic. So be careful with that. I'll suggest that you also try to take off your loupes or your glasses if you're wearing glasses. But ultimately, again, like I mentioned, the window to much of your world now as a practitioner from the eyes of the patient is your eye region. So your glasses and your loupes are going to obscure that. Perhaps not as much, but ultimately it's something to consider. If you're going to have a difficult conversation or a involved conversation about treatment planning or whatnot, maybe just drop the loupes down. Keep the mask on because you have to, but ultimately the loupes can go down around your neck as they always have, and then you have free access to the eyes and the eyebrows. So the bottom line is that your face is more important than ever, especially your eye region. Make sure that you're still wearing your mask and abiding by all the rules and regulations and good safe practices. However, make sure you're also really just accentuating the eye region and just overall focusing on communication, inflection, and just being more accessible to your patients. Thanks for watching. I appreciate it so much. Hope these tips were just kind of a nice little way to get some ideas flowing. If you have any additional tips or you'd like to comment or give some thoughts, go ahead and do so down below. I appreciate all your viewership as always. Thank you for all your comments across all social media. I really appreciate it. As always, please like the video, subscribe to the channel, hit the bell so that way you could be notified on your phone when I drop a new video. And until we speak again, have a great rest of your day. Take care, stay safe. Bye-bye now.